Hi, my name is Janet. I'm a fourth-year student in the General Science program with a focus in biology. My research topic is thinking outside the brain. Are muscle spindles a missing piece in the dystonia puzzle? This independent research project was done under the supervision of Dr. Howard and Dr. Strzelecki at Mount Royal University. In this short talk, I will provide you with the highlights of my research, including dystonia as a movement disorder, sensory feedback abnormalities, and the role of muscle spindles in dystonia. So what is dystonia? Dystonia is a movement disorder that involves involuntary muscle contractions that results in repetitive twisting motions and abnormal postures. About 50,000 Canadians suffer from dystonia, making it the third most common movement disorder after Parkinson's disease and essential tremor. I chose to focus on upper limb focal dystonia, examples of which are writer's cramp dystonia and musician's dystonia. In both cases, involuntary contractions are triggered by the performance of voluntary movements such as writing or playing an instrument. One of the motivations for this project is that the disease mechanism of dystonia is poorly understood. Dystonia is a complex heterogeneous network disorder, and there are three established pieces to this puzzle, which includes the presence of reduced inhibition, abnormal plasticity, and impaired sensory integration. A knowledge gap and a missing piece to this puzzle that I found interesting is the presence of excessive sensory feedback. So, could proprioceptive input from muscle spindles into this network contribute to the disease mechanism? What is proprioception? Proprioception is the ability to sense the orientation of one's body in space. It is critical to the control of voluntary movements and reflexive movements. There are a variety of receptors that contribute to proprioception, but the most important are muscle spindles. Muscle spindles are specialized receptors located in skeletal muscles that detect stretch and changes in muscle length. The interesting thing about muscle spindles in relation to dystonia is the ability of gamma motor neurons to independently fine-tune the sensitivity of muscles. So I believe that muscle spindles are abnormal in dystonia, which would account for the dystonic symptoms that we observe. I would like to talk a little bit now about sensory and proprioceptive dysfunction. Does sensory dysfunction, 1, predispose one to dystonia, 2, manifest only when dystonia is present, or 3, the sensory dysfunction trigger dystonia? Studies have tried to address this by using vibratory stimuli to activate muscle spindles. In figure 12, it shows the results of proprioceptive afferent processing of 15 patients with writer's cramp. Using tonic vibration reflex, it was found that vibrating the forearm muscles resulted in dystonic postures in 12 out of 15 of these patients. So contrary to the control counterparts, the increased angle observed in dystonic individuals suggests that dystonic muscles are in fact hypersensitive to vibration. And so while vibration activates muscle spindles, cooling reduces the activities of muscle spindles. In about 10 writer's cramp patients who underwent the cooling of their forearm muscles, it was shown that there was a significant improvement of writing performances. And perhaps the most impactful is the relationship to botulinum toxin, which is the primary treatment for focal hand dystonia. Botox acts to reduce muscle activities by weakening muscle fibers. This effect is said to last for up to 7 months. In figures 16 and 17, it shows that tonic vibration reflex, TVR, is the most impacted or reduced by botulinum toxin treatment. And so in conclusion, this research project leaves us with outstanding questions. 1, is gamma drive abnormal in dystonic muscles? Or 2, do abnormal spindle properties exist, or is it both? And number 2, are muscle spindles Are abnormal muscle spindles a mechanism or a consequence of the disease? Future studies should make use of microneurography, which is a technique that is used to investigate the muscle spindle firing rate in both dystonic and normal muscles. Thank you so much for your time, and I look forward to answering all your questions on Tuesday.